Joining me now is an infectious diseases expert and physician, Professor Paul Griffin from the University of Queensland. Professor Griffin, thanks for your time. What's your take on the numbers we're seeing out of New South Wales at the moment? Is there any cause for optimism?
Look, I think we can start to be optimistic. Obviously, we don't want to overcall anything until the data supports it, but it does appear that the numbers are at least plateauing, if not starting to decline. And as we've heard a number of times, it takes time for the mitigation strategies to transfer through to a change in the numbers. So hopefully over the coming days, we'll see the impact of the increased mitigation strategies, and hopefully those numbers will continue to fall.
And the Victorian situation, what's your analysis on that with the lockdown to be extended beyond tomorrow?
Look, I think that the lockdown is easily justifiable in this case. Obviously, we saw a really sharp spike in cases and we've seen a similar number today. So at least things certainly aren't getting out of control or heading in the wrong direction there, but we're far from being through that situation as well. So I think having some fairly firm mitigation strategies for a few more days at least does make sense to get back in control down there too.
Paul Griffin, when we've got our two largest cities in lockdown, as you and I are speaking this afternoon, so many of us are wondering, what will the Doherty Institute come back with in terms of its modelling? What number do we need to get to? The government, the federal government, should be receiving this. Under my understanding is they will get that before the end of this month. It can't come soon enough, can it, for a bit of clarity as to where we need to go to?
Yeah, look, it's challenging. I mean, the big thing here is the situation continues to change very quickly. And modelling is really useful and we need to rely on that to help us make predictions and to make decisions. But, modelling is just that. It doesn't necessarily predict the future. And so we do need to be able to respond to the situation at hand. And, that's what we're seeing across the country at the moment. And the most important thing here is we can change our trajectory. And the most important way, the best way of doing that is, of course, to increase the rate of vaccinations. And if we do that, then the sort of situations we're seeing unfold now and the sort of strategies to combat that hopefully will become a thing of the past. So just can't highlight strongly enough how important the vaccination really is here.
And 1 million Pfizer vaccines arrived overnight. That's an important milestone. As we marked 10 million doses, that benchmark was hit over the weekend.
Yeah, it's huge. There's no secret that supply has been one of our biggest constraints in terms of getting this rollout happening and getting it where it should be. And another amount of 1 million vaccines obviously makes a huge difference. And my understanding is that's the sort of number we can expect on a fairly regular basis for the next few weeks. So that's going to make a huge difference, of course, if we have enough ways of getting those into people's arms and enough people turn up to get them. So I'd strongly encourage people to make sure that they get their vaccine at their first opportunity.
We're seeing the Delta variant have an impact on children. Should kids be vaccinated, as they are being in some nations around the world?
I think everyone agrees that children definitely should be considered for vaccination. The difficulty in our country is we just don't have enough adults done yet to move on to children right now. So definitely children should be part of the planning, but I think we need to get the adults done first. And, we know we've had to have the rollout done in a prioritised fashion because our supply simply hasn't been adequate to try and open it up to everyone all at once. We rightfully prioritise elderly people who are most at risk of significant consequences. We need to get those younger adults done because they are responsible for the bulk of the transmission. And once we've done enough of that group, then definitely, yes, we should move on to vaccinating children as well.
And talk us through the vaccination efficacy when it comes to the Delta variant. Is it as effective against that variant as it is against the previous episodes of COVID-19?
It probably is slightly reduced, but I'll stress slightly. It still works tremendously well. So, we see this vaccine certainly reduce the probability of people getting infected, although that's clearly not 100%. It definitely reduces the chance of getting symptomatic infection, but it very significantly reduces the prospect of progressing to severe disease, hospitalisation and death. And that is near 100%. So that's remarkable in terms of how well it works. And that's why we just have to stress how important it is that people go out and get the first vaccine they have the opportunity to get.
It's an absolute no-brainer, and particularly when you look at the situation internationally, when people have received the 2 doses of either AstraZeneca or Pfizer, in upwards of 90% the cases where others might have got COVID-19 around them, got seriously ill, and those who have been received double jabs don't get it, and if they do, have mild symptoms?
Oh, look, that's exactly right. We've seen time and time again great examples of where it does stop people getting infected. And, we are seeing some countries still have reasonably high case numbers, but the really important thing there is proportionately the number of people that are progressing to significant infection or more severe disease has dropped remarkably. And, that's the position we need to be in when we can hopefully consider opening up like other countries are doing and relying on having lockdowns as a thing of the past instead of relying on them to maintain control as we have to right now.
You know better than anyone, as a nation, we've been quite effective in terms of vaccination rates, among the best in the world. Do you think the fact that the pharmacies are now, community pharmacies are going to be involved, that as well as GPs and others, it's going to help reduce the hesitancy? Because if someone is worried, they can go and speak to their pharmacist, someone they would see regularly and picking up their normal medication almost on a weekly basis for many people. That surely will help facilitate and manage some of the hesitancy out there.
Oh, absolutely. It's great to get our pharmacy colleagues on board. They're traditionally an integral part of our flu vaccine every year, and obviously their main business is in logistics and supply of medications, and of course, as you say, answering questions of patients with regard to medicines. And so getting them on board is going to be a huge step forward. Of course, not detracting for a moment from how well the GPs have done with this and how important they are moving forward. And I think we also need mass vaccination hubs, and I think we need those to be open at all hours so people who are working irregular shifts also have the opportunity. I'd like to see that now that our supply issue is alleviated, that there are no other barriers to anyone who wants a vaccine getting one and getting one quickly.
Absolutely, makes a lot of sense. Professor Paul Griffin, as always, appreciate that.